The financial constraints that we're faced with in both universities and hospitals and life are really driving the need to change models of care. We can't afford to do the things the way we have in the past, and so we need to look at gaining efficiencies whilst increasing effectiveness.
So QPS is Deakin's Centre for Quality and Patient Safety. Now, it's a partnership that they have set up with numerous health services, Eastern Health being one of them. The benefits are really for our patient experience and outcomes. We know, and the literature is prolific, if you've got an active learning and research agenda within clinical care, then your care outcomes are better, your evidence-based care is more contemporary, and you're actually able to improve things.
Understanding how hospitals work and the day-to-day pressures that clinicians experience, having that really intimate knowledge of how they work is really important to understanding what's going to be important in terms of research that you undertake, but also the logistics and feasibility of the research that you're doing.
My journey into research, I think, came from that desire to always understand the how and the why, and not just accepting things for the way they are. The partnership between QPS and Monash Health provides an opportunity and a gateway for Monash Health and clinicians to ensure that we're up to date with the latest evidence-based practice.
One of the key elements of the partnership is the joint appointments. The way that the people within the partnership straddle the organisations to deliver on both agendas is a credit to them.
That marriage of the clinical nurses with the academic support is really essential, and it's something that we really have been working on here at Alfred Health to ensure that our nurses have those opportunities to be supported to ask the clinical questions and hopefully provide some further information and resource to the rest of the nursing community.
As a chair, we straddle two worlds, and we have to work really closely with the clinical environments because we're embedded in the clinical environments, whilst also performing high quality research.
So our partnership started back in the mid-90s, and the partnerships have grown over the years. So we've now got 6 partner organisations that are major health services in Victoria, and also public and private. So over that network it covers over 30,000 nurses and midwives, and across the hospitals they treat over 3 million Victorians every year.
If there is evidence to support what is practice, then we need to translate that evidence in and make it applicable for practice so the clinicians can use it, and really making sure that we're doing care that is of value.
We really try and tailor the research to be meaningful and important and addressing a clinically important issue. It means that the research is much more likely to have impact and influence practice and change in the health service.
QPS and the Institute for Health Transformation are incredible partners in order to be able to deliver better outcomes for our community. That's why we're all here, is in fact to do that. We do that both through experience, through outcomes, but also that for our workforce as well. They are the deliverers of healthcare. That's what healthcare is all about, people for people. And the Institute, the Centre and our partnership are just testimony to how you can actually bring that to life.